Good afternoon, everyone. Good afternoon, everybody. This is Rhodesia Ransom, Councilmember Rhodesia Ransom from Tracy. And this afternoon, we are going to be doing our community town hall with Dr. Maggie Park. We are going to be going over the roadmap to recovery from COVID-19. We have been in shelter in place since March, and you all have sent a lot of questions as to what needs to happen to get back to business and what we're going to do in order to meet the requirements of the county as well as the state government. So today in our town hall, we are fortunate enough to have our public health director who is going to be joining us. This is a virtual town hall, so we are all in different locations. So before we get started, what I want to do is kind of give you a little bit of the ground rules of how this will work. We are broadcasting live on 2 platforms currently, on Facebook as well as on YouTube. We have a couple of volunteers who are going to be helping to manage this process in regards to the questions that come in, because we don't want to miss any questions. We'll be, if people are asking similar questions, we're going to kind of group those questions together. So I'm going to introduce you to the people who are in our background studio, who will be helping with answering questions from the community. And this should be very simple. Dr. Park will be available. She's going to give us an update. We're going to give an introduction, and we will go from there. Like I said, working from home. If you hear a doorbell ring, forgive me. But we look forward to answering your questions and really helping our community figure out what we can do to get back to some normalcy. So with that, I'm going to bring onto this screen and introduce our volunteers. So I have Mr. Pearson McLean here. Pearson is a student, high school student. He is going to be asking questions that come through our Facebook stream. And then we also have Mr. Nathaniel Tran. Nathaniel Tran is a graduate of Tracy High, now in college. He is going to be asking questions that come through YouTube. We've also got other questions that have already come in. So I want to thank them for volunteering. And with that, I am going to introduce to you Dr. Maggie Tran, excuse me, Dr. Maggie Park, who is our public health director. Dr. Maggie Park is a public health director at San Joaquin County. Prior to that, she was the medical director for Children Medical Center. She may correct me if I said that incorrectly. But she has really been leading our county. I'm sorry if I got that wrong. She's been leading our county first as the interim public health director, and she'd been doing that for some time and happened to be nominated before the pandemic, and then got the opportunity to now be our permanent public health director. Has been issuing the health orders, shelter in place orders, making sure that we are honoring the governor's updates as they come through, and really trying to help us figure out how we're going to go through the different phases. Our governor has issued the different plans and the steps and strategies that we need in order to be able to safely and surely return to business as normal. So with that, we're going to introduce Dr. Park. She's going to give us an update, and then be able to share different things that the county is doing and answer the questions that you all have been asking. So welcome, Dr. Park, and thank you very much for joining us.
Thank you, Rhodesia. You pretty much got it right. I have been with San Joaquin County Public Health for over 5 years now, and my previous role was to be the director of the Children's Medical Services Division, which is hard to say, but that's the division that oversees California Children's Services, the Childhood Lead Poisoning Prevention Program, our foster care nursing program, and our child health and disability prevention program. So I've been around for a little while, but you're right, I am now the health officer, which is a different role for sure, and started off as interim, and now I'm the health officer as of very recently. So thank you for having me.
Problem. Thank you very much for joining us. So can you walk us through, if you can walk us through kind of an update starting from, the steps that have been taken to get us to this point. And I think what most people are anxious to know about, I know I get a ton of emails about when we're going to end this, how do we get back to business? Why do some businesses get the opportunity to go back to work and others don't? And I think really what people are looking for is some clarity. So if you don't mind, if you can kind of give us kind of an update on where we are, how we're responding to the governor's request, and do we have any challenges? I know there's some unique differences here in our county. So if you can address those items before we get to the questions, that would be great. Thank you.
Okay. Well, yeah, that's a lot. I'll try to remember all your questions. How did we get here? Boy, it seems like a whirlwind. This whole thing started for us in the beginning of January, really. So although it's called COVID-19, to me, it's more like COVID 2020 is when it happened to us. And that was just a few short months ago, and so much has changed in that time. So the knowledge about this virus is evolving, and the rules have all been evolving. And we started off just waiting for COVID to strike and didn't have any cases. So we were in a containment stage. And containment means you're just trying as a public health department not to let it come. So preaching the hand washing and the social distancing and learning about the transmissibility of this virus. Then we did get our first case of COVID, which we knew was from travel, from a cruise ship. And then as time passed, we had more cases of COVID, which we could not track back to travel or to a definite exposure. And that's when you say that you have a community transmission case. And the more community transmission we got, the more evidence there was of it just being moving around in the community without any clear history in the people who were getting it. And that's when we moved from containment to mitigation. And mitigation means you're trying as a public health department to now stop the spread, the rapid spread of it once you have it in your community. We're at a point now where we have 659 confirmed cases, and I think we're at 31 deaths. So, time has just passed, and unfortunately we've had some people who have succumbed to this disease, which is really sad. But now as a county and as a state, we move back into containment, which means as we see that our hospital numbers are not so bad and we're not reaching those terrible peaks of surges that we were really trying to get away from, as we see that things are stabilizing now, in order to let people out, in order to loosen restrictions, we go back to what we were doing back in the containment stage, which is heavy isolation of positive cases, heavy contact tracing of all the exposures, and trying to get them quarantined. So this is kind of where all the counties are at across the state, is going back into isolating and quarantining and putting a lot of effort into that. So back into containment.
Awesome. Thank you very much for that. So you brought up some things. Contract tracing, I know, is one of the governor's points. And if you can kind of let us know, what does our county have left to do in order to get in alignment with the governor's restrictions and requirements in order to start, getting out of shelter in place? And then also, right. I think for some people, if you can explain what contract tracing is, that would be awesome.
Sure.
Contact tracing.
So contact tracing is something that's not new to public health. It's something that we've done all the time for things like tuberculosis. It means finding out who's positive by testing, of course. And then after you find out who's positive, you isolate them so that they're not a risk to the rest of society. And then you go ahead and you try to go back and find out everyone that they've possibly infected. So who do they live with? Who do they work with? Where have they been in public places? And for us, a contact is defined as being within 6 feet of someone for 15 minutes or more. So that's considered an exposure. And if what contact tracing does is it tries to find as many exposed people as possible to a person who has COVID, and then asking them to quarantine, asking them to stay home as much as possible, and following them for their symptoms, checking in on them, asking them if they've developed any fever, cough, any of the symptoms, And if they have, then really pressing for them to get tested as well. So that's what contact tracing is. It's quite burdensome because it's almost like building out a family tree and expanding and expanding. And the more you find positives, the more you have to then go down that rabbit hole and find out who else was exposed. So this is very time intensive and takes a lot of phone calls, basically.
Wow, that's quite the feat. So, with that being said, how close to being aligned with the governor's plan, recovery plan? How close to being in alignment are we with being prepared to do all of that, contact tracing and all of the other requirements?
Well, that by requirements, I think you might be referring to the attestation metrics that were handed out by the governor last week that everyone's looking at. So I'll try to explain what the requirements are. Basically, everybody in the state of California was in stage 1 together. And stage 1 was defined by our governor as a stage during which essential workers could still go to work. Others were asked to stay home. We were trying to get our elderly citizens and people at risk to stay home and make sure that vulnerable populations were safe at home. So that was stage 1. It was getting ready to reopen and bring some other workers back to work. Then on May 8th, the governor announced that we were moving together as a state into stage 2. So everybody was waiting with bated breath for this stage 2 because stage 2 was a long list of things that the governor had put in his roadmap would be opened. He didn't open everything on May 8th. He opened a few things, and it was like a soft opening into stage 2. So it was that curbside retail and delivery retail with associated manufacturing and logistics. So toy stores, furniture stores, clothing stores, bookstores, shoe stores, home goods, the florists, those things, and anything that was manufacturing or logistics related to that retail could be opened. So it was really basically everything as far as sales go and manufacturing logistics, but with the caveat that you could only do curbside pickup. You couldn't go into the store and touch and feel the merchandise. So that was our entry into stage 2. We did it as a state together. And the other things that are in stage 2 on the governor's roadmap include some big ticket items like destination retail, so the opening of shopping malls and dining in restaurants, which a lot of people are waiting to have the ability to do that again. Those were not open on May 8th. And so this is the rest of stage 2 as we progress. And what the governor said was that some counties could hit the rest of stage 2 and other things in stage 2 faster than the governor's own rate if they could demonstrate certain metrics that were met. So one of the metrics is contact tracing, and I can show you on our graph if we can bring up the screen where we're at with that, because our website does actually have all of these measures. So if you were to get on the San Joaquin County Public Health Services website, if you look, and you have to kind of get this map to get bigger. If you click on the portion that says click on the dashboard, you can see that we've tried to put together a dashboard of the metrics. These are called the attestation metrics, meaning the governor has said a county can attest to their readiness to move forward ahead of me, to open dine-in restaurants and to open shopping malls ahead of the rest of the state because you hardly have any COVID and you've got it under control. So these are metrics he put out last week, and this is where we're at as far as meeting them. If you notice here at the bottom on the left-hand side, the measurement that was being asked for was that you have 15 contact tracers per 100,000. So our county has a population of 762,000 people, which means we need 114 contact tracers. And you can see that we had put this in red because we had 50, but we're very closely getting to the number that we need, the 114, because we've had a lot of volunteers step up. So we need those volunteers to get trained. There's a 20-hour training that the state is requiring we do. The state purchased a data software management system, and is getting everyone in the state to use the same system, to enter the same system for putting in your names of exposures and isolated people. And everyone has to go through this training. So once we get everybody trained, we really do have 114, and that measure is almost met, although you see that it says unmet right now.
Wow. And what are the qualifications of someone to become a contact tracer? Are those doctors, nurses, or are they just people that your department trains?
At this point, 20 of them are internal staff, so they're public health people who have already worked in our communicable disease department. 30 of them are people who are coming from within the county who don't have public health experience, but were furloughed or working at home. And so they're already county employees, so we've asked them to join us temporarily. And the rest are volunteers. And there's no real experience required. They do have to make it through the training, and if it's too much for them and maybe they're not fit for it, then of course we would find that to be unsuitable. But we are training and we're supervising, and we have a lot of people who have been assigned as supervising nurses who will be supervising the staff of 114.
Awesome. Thank you very much for that.
Mm-hmm.
So with that, we have some questions that people have sent in. I don't want to jump ahead of your presentation. Did you want me to go to those questions, or is there any additional information you want to share about how the stay-at-home order has been helping to flatten the curve, or any of that information?
I can go to questions. I think maybe some of the questions will lead us back to the dashboard maybe. So maybe
Okay.
I can finish off the dashboard and the other metrics as we go along.
Awesome.
But just very quickly, we definitely have flattened the curve. That much is true. So very happy to say that, and hopefully we can stay there. And I want to thank everybody in the public for helping us reach that goal.
Great. Thank you so much. We're going to go ahead. I'm going to start with Pearson. I know a lot of people have questions about how they're going to get their business reopened. I'm going to go ahead and start with Pearson. What is the first question, Pearson?
Okay, so Rhodesia and Maggie, we have a question from both the city and Anthony. What do we need to do, and when can we open beauty and barber salons?
Mm-hmm. So that dashboard that I just showed was just all the metrics that we would need to accomplish in order to move through stage 2 at an accelerated rate, faster than the rest of the county, faster than the rest of the state. However, the state is expected to enter stage 3 together again. And that is where hair salons, nail salons, and all of those services are. So unfortunately, that's a stage 3 event according to our governor and our state health officers. So we legally have to follow that. So there's nothing really that we can do to affect that. Send the governor your letters if you want to try to affect that. He has said in public statements that we would be moving into stage 3 in months, not weeks. And then he's changed that to now he's saying it could be in weeks, even a month or less. So I believe there's a lot of pressure at the local level and the state level to get these things open, the things that we all want. We all want hair and nail and our barbershops opened, and the other stuff in stage 3 that so many people find important. We're trying to get there, and I know that the governor's feeling that. And so now in his most recent comments is that we're going to get there in weeks. So now he's talking in shorter time periods. So I'm hoping it happens soon.
Wow. So I think if I heard you correctly, the hair barbershops and nail shops, those are stage 3 that we all as a state, we as counties, we don't get to arbitrarily set those requirements or have any sort of certification. That is something that the state of California will have to give us permission for. Is that correct?
That is correct. And he has put that in stage 3, but there's a lot of political movement and pressure for him to get that moved into stage 2, or to get to stage 3 faster. If that's where you're going to keep it in stage 3, then let's just get there faster. So I don't know. I do know that the California Board of Cosmetology has said that anyone who tries to open up sooner than the governor are putting themselves at risk for having their licenses removed. So I strongly discourage people from trying because I really feel like there could be some bad consequences. But, I honestly want those things opened. Everybody does. So we'll see. Hopefully it's coming soon. He's supposedly going to be making some announcement on Tuesday. So it seems that once a week he's moving along. He did the curbside retail, and then the next week he came out with pet groomers and dog walkers and car washes. So it's like he's given a little bit every week. So we'll see how fast we can move through stage 2.
Thank you. And I really appreciate you for giving the advice from the barbering and cosmetology board, because when we, as electeds, we get calls and we tell people, they're saying, well, what if I just go ahead and do it anyway? Are you going to enforce it? And I think people need to understand that we don't control licensing. And I would personally hate to see people lose, their licenses. So those are things that people really need to be aware of with their own, industry as they are trying to jump ahead. Of this very unfortunate situation. Okay, so our next question is coming from Nathaniel. Nathan, you have a question there?
Yeah. We have a question from Nancy Young. She was asking sort of a two-parter. First, let's see. Oh, basically she's asking what are the requirements to become a contact tracer? And how can you go about training for one?
Yeah, we answered that question a little bit earlier.
Mm-hmm. Yeah, if she wants to put her name in, she can email the San Joaquin County Public Health Services. We're taking volunteers, and the next wave of training is starting next week, but every week there should be another wave of training and another wave. So it's a 20-hour training that's going to restart every week. So go ahead and put your name in. No
Awesome.
requirements. No requirements.
Okay. She's actually one of our city council members in our city. And so another one of the questions she has, is there only one requirement in regards to contract tracing, or are there more requirements?
We're going to put together a job description through our county HR, but it's not really a job because you're not getting paid. But we still have to put together a description of what a contact tracer does. And then you have to sign on a volunteer agreement, and then there's a HIPAA agreement you have to sign saying that you are going to be adhering to privacy rules and laws.
Got it. Okay. So one question that we have here, I'm going to go back to Pearson in a second, in regards to frontline workers and haircuts for like law enforcement and firefighters. Are people allowed to do those kind of jobs? Is there any sort of exception for those people? Don't shoot the messenger.
I know it's happening, so I hesitate to answer because I know that's really happening out there, and I don't want to get people in trouble. But the theory is the same, is that whether you have a salon where people are walking into your salon, or you're a licensed hairdresser and going to someone's house, it's still prohibited because the theory is that it's still high contact personal service. And so something that's in stage 2 is tanning facilities, and yet hair and nail is in stage 3, and it's all personal services. But the governor and his team of experts has deemed tanning services to be non-high contact. But when you're touching someone's hair and nails, you're right there next to them. And I know everyone's saying, I'll wear a mask, I'll wear gloves, and I want so badly to say, sure, go do it, but it's not up to me. So it's still a no-no, although I know it's happening. Just do your best to decrease the risk as much as you can.
Yeah, and don't let us find out about it. I think that's what I hear. Okay, so thank you. And I think it's important, that you are. I think it's important that we let people know that we see the struggles that they're having, and we see kind of the disparities and the inequality, and it's really hard. That's why you're here. It's because I'm having a hard time to explain to people, well, if I can do pet shop, why can't I do a human? And I'm going, you know what? We're going to have Dr. Park answer that question for you. So Thank you for that. Next, we have another question from Pearson. Go ahead, Pearson.
Okay, so Wayne Adler asked, how can one county open and another close? We travel all over. I work in one county and live in another.
Yeah. So we're all supposed to be at the same point in time along with the governor, unless you're talking about a county that was allowed to attest. and there's many now. If you go to the governor's website, you will find the list of counties that were able to make all those attestation metrics and have been allowed to move through stage 2 at a faster rate. So they were allowed, they're allowed to do everything that we're allowed to do, the curbside retail, the pet grooming, the car washes, the stuff that he opened on May 8th and May 12th. But in addition to that, they were allowed to go into dine-in restaurants and shopping malls because they had such low rates of COVID, and they were able to meet all the metrics, like the metric I showed you on the dashboard with us needing 15% of 100 per 100,000 people, 15 contact tracers per 100,000. Those counties have attested that they've met all the metrics and they've opened. But the rest of us, we should all really be along on the same page. And so if you're saying that some counties appear to be more open than others, I really can't explain that. We're all supposed to kind of be looking alike. That's the goal. But I know people are getting tired, and people are, starting to kind of break the rules here and there. And so certain parts of our county look more open than others.
Thank you for that, Dr. Park. Another question that has come in, and this question has actually come in from people that are in the medical community, frontline workers. Alameda County has implemented a mask plan for people going to essential jobs. Why hasn't San Joaquin County implemented a masking plan? Can you give us some insight as to what our county's approach is to that?
So this is actually a really good question and a really tough question that has been asked of me several times, and I battle with it. There are different ways to do these masking orders. And at first there were just a handful of counties that were doing it, and now I think there's a little bit, still less than 10, I'm not sure, that have made universal masking orders. That's not to say that they're saying that you should wear a surgical mask or an N95, but just the cloth facial covering. And then there's certain other entities that don't make a universal masking order, but just an order for certain places that you would go. The universal masking order would be something like what some of the other counties have, that say you are ordered to wear facial covering anytime you leave your home and go out in the public. That's a really hard one, highly controversial. I know there's some science behind it and I know the CDC recommends it, and the Surgeon General even turned about and recommended it. I'm trying to be in line with what the California Department of Public Health is saying, which is that we strongly urge it and strongly recommend it. But to order it, we haven't gotten to that point. There's so many people out there who feel like it's outreach of the government to a tyrannical degree, taking away their rights. And it has become dangerous in certain parts of the country. And it has led to people getting killed. And so I have thought very deeply about it, and it concerns me that there are some people who are on both sides of the issue, and I don't want to see anything dangerous happening. There's even health officers who are receiving threats in the counties that did make this universal masking order. So it's a tough one. But I have always said that we're going to strongly encourage it, and that certain companies can make that a requirement. So, Costco made it a requirement. Our county buildings can make it a requirement. Your city hall could make it a requirement. Anybody could really make it a requirement. And so it's not off the table that I make it a requirement for entering public spaces. It's something that's on my mind. And, as we open up the county more and more, and more people are out and about, and they're going to be allowed to be out and about, I've got to watch the trend and see if that really affects our numbers. And if our case counts go up high, maybe we need to do whatever we need to contain the numbers. So it's not completely ruled out, but it hasn't risen to the point where we've made it an order at this time.
Awesome. Thank you for that. What about gloves? Gloves is another one that's pretty controversial. Do you recommend that people use gloves to protect themselves? Or there's also the argument that gloves are doing cross-contamination?
So in general, I don't recommend gloves. I wear my face mask. You can probably see my face masks on my desk here. My room is such a mess, but they're back there. But I don't do the gloves. because when you're wearing gloves, you're going to still touch hard surfaces and surfaces that might have virus on them, and then you're still going to be tempted to touch your face. So really what we at Public Health say is, the glove might give you a false sense of security because you think you're safe, but as long as you're still touching surfaces and you can touch your face, you're at risk. And so what we really think people should do is just wash their hands a lot and use hand sanitizer instead of going from place to place for hours at a time with the same pair of gloves on. In certain industries, it might make sense to wear gloves, but for the general public, no.
Thank you so much. Okay, we're going to go back and bring Nathan Tran back. Nathan has the next question. Go ahead, Nathan.
All right. We have a question from Sandra. When would youth sports or sports fields reopen? What sort of stage are those programs in?
I'm not sure, Sandra. Very good question, because I've seen it in stage 2 and I've also seen it in stage 3, and then officially on the governor's website, it's nowhere to be found. So I don't know. A while back when this roadmap from the governor, roadmap to resilience for state of California, was developed, I was shown something that had youth sports coming towards the end of stage 2, and then other sports like big sporting events where there's large amounts of people in the audience, that was clearly in stage 3. So I saw sports in 2 different places where there was that distinction made. But I don't put it in my county's roadmap because I have not seen it anywhere official. I want to see it on an official document before I say for sure that I know. And when I search for it through all my emails from the state health officer and from the CDPH, and as well as when I search the governor's websites and the CDPH website, I can't find the distinction yet being clearly made. So I don't know, and it really depends on the sport. I think like youth baseball might be at the end of stage 2, whereas swimming, which is my kid's sport, might not be till public pools get opened in stage 3. And so it's not clear. The delineation is not clear yet. So we'll have to see.
Thank you so much. Our next question will be coming from Pearson. Go ahead,
Okay,
Pearson.
so the Boys and Girls Club have a few questions. The first one, kind of relating to the last. What is your recommendation for youth serving nonprofits regarding youth summer programs?
Thank you.
This another tough one. These are some tough questions. Just a week ago, I was on a call with all the health officers of all the counties, and this very question was brought up. And the California Department of Public Health doctor said that she thinks summer camps are off the table, and she doesn't think they're going to be happening, and just expect them not to happen. And so that statement was made to us. And then the governor came out, and when he said that we could do pet grooming and car washes, he also said childcare for non-essential workers. So originally it was childcare for only essential workers could be opened. And then he added on May 12th, childcare for non-essential workers. So some counties have interpreted that as saying, okay, not just childcare for little kids in preschool, but now we can open up our summer camps. So, and I don't know what the true interpretation is for that, and I have to get clarification, but I know that a lot of our local summer camps have already decided to start taking enrollment, and they're promising people they'll get their money back if the law is clarified and they're told that they cannot open their summer camps. So I'm actually going to be on a call with the state again today at 5 o'clock, and that's one of the questions I want to ask is, when you say childcare, are you including summer camps? The Bay Area has 6 counties that have bonded together, and they do everything together. And their order actually lumped in summer camps with childcare. So their order says you can have a summer camp, but you have to follow their rules, which is 12 kids at a time, cohorted together, not mixed with another group of 12 kids, because if one kid falls ill, then you've just got 11 others who need to be tested, and the other group is safe. So it's all about cohorting, not mixing groups, keeping these kids 6 feet apart when they're outdoors and doing activities, and very small groups. So what I would say is, for anyone who's trying to get ready to open up a summer camp, go to the governor's website, look at the rules on childcare facilities, because there is guidance for childcare, and as best as you can, get ready to follow something that mirrors that guidance, because that's probably what it's going to look like. But very good question.
Awesome. Thank you so much. I'm going to bring Nathan back. Nathan has another question for you.
Hi, I got a question from Doug Wheeler. Why do some counties allow the opening of churches and others do not? Is it supposed to be a phase 3 guideline?
Definitely supposed to be a phase 3 guideline. And I'm sorry, I hate saying that because I get so many letters from churches. And it's all about that contact and high capacity and the governor's experts talking about how close people get together in those situations. Many churches writing me letters saying that they know how to socially distance and they can keep people 6 feet apart and not pass out food. And it all sounds so wonderful, but still in the end, churches have been put into stage 3 as far as in service faith services. The drive-up services are allowed by the state, but it's very restrictive. What happened was back around Easter time, a lot of us counties, we didn't know what to tell people. We asked the state for guidance and they said, well, you could do drive-ups. And so we kind of all just muddled through it and made our own guidance. And a lot of us said, you could do drive-ups, but not get out of the car. And that's how you could do a gathering. And that's the best we can give you. One county, not ours, but one county actually got sued and lost to a church because the attorney general for the state said, you should have allowed the drive-through services because a lot of counties said no drive-through. So the attorney general said you should allow drive-through, but just with people not getting out of the car. So that's kind of what mutated into the guidance for graduation ceremonies. You can gather, but nobody can get out of the car. So a lot of that got mutated into other things. That's where we stand right now. Is churches can gather with cars 6 feet apart, windows rolled down so you don't get heat stroke, but 6 feet apart and nobody getting out of the car, and everyone in the car has to be from the same household. So that's where everyone is supposed to be. I don't know what county has their churches open. That doesn't sound right to me. I don't know what to say about counties that are opening churches because no county is supposed to be in stage 3 yet. There are some counties that were allowed to accelerate through phase 2, but they're not allowed to enter stage 3 yet. So I don't know who's doing that.
Okay, thank you for that, and thanks for going over the variants. Okay, so we're going to take a few more questions, and then there's a final question that will be asked about what we can expect as far as the fall and another round of this COVID. So the next question is, I believe it's Pearson. Go ahead, Pearson.
So Nancy had asked a question earlier about how long until those in training will complete the training. I think that's the most of her question.
It's like a 5-day training. It's like 9 to 1. But really we're finding that it's over by 12 or 12:30 in most cases. So we were in the pilot. It just literally started last week. The state of California just bought this program, just started working with UCLA and UCSF, and our county volunteered to be in the pilot. So the 20 that worked here that I told you about, they started on a Friday and they ended on a Wednesday. And it was like every morning 9 to 1.
Awesome. Thank you so much. Nathan, you have another question?
Yeah, I have some questions from the Chamber of Commerce for San Joaquin County. For starters, do we have a timeline for when we think we'll reach phase 3?
Yeah, again, like I said, the governor's latest new words were weeks, not months.
Mm-hmm.
So he used to say months, not weeks, and now he's saying, oh, everyone just be patient. It'll be weeks, not months. I don't know how many weeks he's talking about. And we keep asking these questions to the state ourselves when we're on calls with the state, and they won't tell us. Because I think the people who we talk to don't know themselves. So the experts are watching our curve constantly and making decisions based on California's curve.
Thank you. We do appreciate your diligence and continual follow-up with the governor and those who watch the Board of Supervisors meeting and see those updates. And we're watching, the different public health websites and notices come out. So we do appreciate your diligence and thank you for trying to, help us muddle our way and figure out how we can get back to business for all of us. Nathan has another question. It looks like it's about a drive-in, I believe. Nathan, go ahead.
Yeah, the Chamber of Commerce also asked whether it was possible to do drive-in movies on private property.
Well, drive-in movie theaters are allowed and drive-ins are allowed, but not with getting out. And that's the problem on a private property. I'm assuming you're talking about friends and family gathering. And unfortunately, in stage 2, the instructions are that gatherings are still at 0. There are supposed to be no gatherings of any size. So you're supposed to stay only with members of your own household at all times. So if someone were to actually get out of the car and try to mingle with someone from another household, that's still a no-no, unfortunately.
Got it. Well, thank you. Thanks very much for clearing that up for us. So we know that we've been talking about, the peak and the curve and all of these different terms that everyone's had to kind of adapt to and try to figure out what that means. So just to kind of wrap this up, 1, has San Joaquin County peaked? And then 2, what do we need to do to get ready? Because we hear that this is going to be back in the fall. So can you address what we can do to try to make sure that we're keeping ourselves safe and actually moving towards getting back to regular business in our county?
Right. So we have different curves. We had the very awful curve with the very, very high peak, the one no one wants to get to. Then we had the flattened curve. And now we have our real curve, which is even flatter than our flattened curve prediction. The high peaked curve showed us peaking in the middle of April. But we never got there, fortunately. Our hospitals were saved from all the good work everyone's been doing. The flattened curve, which was great because that we even have a flattened curve, that was based on our own activities and our numbers. We had a flattened curve, which shows us peaking at the end of May. So we haven't reached the time when we were supposed to peak on our flattened curve. But it looks very good. We don't have this curve at all. Ours is straight across. Our hospitalization rate has become a flat line. So I don't think that we're looking at a May 30th peak anymore. That's still technically the day we were supposed to peak, but we're hoping that we just stay flat and that we never actually go up a curve and then come down the curve. We're just hoping it's flat and that's it.
Is our shelter in place actually helping with that? The fact that we're not outside. I know a lot of people are going, well, we thought we were going to have this big disaster and it never happened, but we've stayed.
It never happened because of the shelter in place.
Right.
It never happened because of our shelter in place. I firmly believe that. I firmly believe that by everybody staying at home, washing their hands, and just doing what we've asked them to do, I know we have saved lives. All of you who have done this shelter in place and stay at home, you've saved lives, no doubt in my mind. Because this is based on real math, real demographics, real math, a really great data scientist working for us, and we beat our own flattened curve. So it's been phenomenal.
Awesome. Thank you so much. Now, what do we need to expect for the fall? I know a lot of high school graduations have been postponed to August. We're hearing that schools may not be, colleges may not start again, in the fall because there are concerns that we're going to be doing round 2, COVID-19 2020, round 2. So what are our expectations for fall and what can we do to get prepared? Because we really, knowledge is power. So we want to be able to help people prepare.
Right. And we've learned so much about this virus. And we're learning every day about this virus. We still don't know everything about it, but we have learned so much from the beginning. So hopefully we're more prepared in the fall if there is a second wave. But we don't know if there's going to be a second wave or how bad it will be. There's a lot of people predicting that. And I think a lot of that depends on our own activities and how careful we are. It's not going away completely. I don't think it's going to go away completely, but hopefully it just kind of tampers down and just kind of gets low level. I think that in the fall you can expect that we're still going to have to be doing a lot of social distancing. Nothing's going to feel quite normal yet. Everyone's still going to be wearing their masks and staying 6 feet apart from each other and washing their hands. That shouldn't change because we all still need to know that the threat is there. As far as the second wave, the national experts from the CDC and even Dr. Fauci are predicting that there will be one and that it's going to come at the same time as flu. So that's the concern, is that sometimes the symptoms mirror each other and the flu looks like COVID or the COVID looks like the flu. It could get complicated because of that. But I think we're more prepared. I really do. We have all these contact tracers now who are trained. We have our isolation and our quarantine orders down. We know exactly what to do. We're going to have testing capabilities that we didn't have at the beginning of this at all. And so a lot of these supplies that we were in need of are getting replenished, and they're no longer so much in shortage. I think we're going to be more ready. As far as schools go, I don't know. It's so hard to say. I know that the Cal State campuses have already said that they're going to go online. And so maybe the UCs will follow suit. And, down to the elementary level, I just don't know. That's still going to be, time will tell.
Awesome. Well, thank you so much for your time. Your department, as well as the county, you guys have put a lot of resources out there. One of the websites that I always use, I post a lot of information, and people always ask, where'd you get that data? So one of those websites is sjready.org. Dr. Park, does that website also lead to the graph you were showing earlier, the dashboard? I know it shows the dashboard for, how many cases, but does that always also show the roadmap to recovery, or is there another website that we should reference for that?
So that dashboard is specific to our website, which is sjcphs.org. So San Joaquin County Public Health Services.org. We have two dashboards on our homepage. The one that's kind of more brownish in color, not this one, was the one that we've had for a couple of weeks, where we show the number of confirmed cases, the number of deaths, break it down by ethnicity, and break it down by zip code. We added this new dashboard when the governor came out with these attestation metrics to show the public which metrics we've met and which metrics we're almost about to meet and which ones we haven't met yet. So for people who want to see if we're close to testing and if we're getting closer, that was what this dashboard was for. So no, those are on our website. Thank you for putting that up. That's it right there.
No problem. In fact, the site that I use quite often is the coronavirus dashboard. I'll go ahead and share that screen. So just for people that are watching, if you go to sjready.org and you click on COVID-19, you can keep up with the cases that we have here. You see that there's 659 cases, and you can click throughout it. You can see what's going on as far as the districts that you live in, where to the right it says rate by supervisorial district. Underneath that tab, there's one by city. So the information is there for you to access. And so, again, Dr. Park, thank you so much for coming out, spending your time, letting our community know where we are with this virus in our community. Is there any final suggestions you have before we log out? Any final advice or suggestions that you have for the community on what we can do to get back to business and to get this roadmap to recovery moving forward?
I just want to say thank you, Rhodesia. I feel like I'm the bearer of bad news, because I know that a lot of the answers that I'm giving are answers that people don't want to hear. Appeal to the governor if you feel the need to have your voice heard. A lot of people are talking to me, but I don't have the power, and I want to explain that to people, is that I don't have the legal authority. But as much as you can, as a councilwoman, if you could keep the work up where you advise business owners and people who need the cash flow, if you can help them get to that cash flow, hopefully that will help, buy some patience and help some people out who really need it. But it's a time where we're really asking for a lot of patience, and I know it's a lot to ask. We still have some quite sick people in the hospital right now, so praying for them, and I know that everyone's hoping that we can stop having some losses and move along with the metrics. But that's one of the metrics right there, is to stop having deaths. And so just wanted everyone to know, your patience is really much appreciated.
Thank you again, Dr. Park. And I want to thank everybody for your questions and for participating. Again, this is the Roadmap to Recovery conversation with Dr. Maggie Park, our San Joaquin County Public Health Director, who's been working really hard to get us on a path to recovery for this community. So again, thank you all, and thank you, Dr. Park. And I just, we're all hoping for the best, and we're all going to do our part. So I just want to thank everyone in our community who has done their part to help end this virus in our community. So thank you again, and you all have a great day.
Thank you.
Take care.
Bye-bye. Thank you.
Bye.